clinical research or what is called clinical trials are types of treatments that are done so that we can make our treatments better than what we've been doing today. So all the things that we've talked about pretty much since morning were all these conclusions came about by some research, some trial done in past. And I, as a doctor, am supremely thankful to the previous generation of patients who have helped to improve the life of our current day patients. And this process needs to continue. The clinical, most of the patients who have cancers do not participate in clinical trials. They don't have to, because some of the treatments have been very, very standard and they have been very standardized. But there are many aspects of cancer treatments, and I guess medicine in general, that still need to get better. So most patients with cancer do not participate in clinical trial. That's fine. But if you specifically look at the certain ethnic minority population, for example, there is even lesser participation than, let's say, an average Caucasian population, at least in US and most countries in the world at this point. This is an important issue because the behavior of cancer, as we've talked about today, is different in certain ethnic populations. I mean, African Americans we talked about earlier today, they have more aggressive cancer. But if you look at so they probably need more information, newer information. And we do not have that, partly because in African American population, Hispanic population, the minorities, their participation in clinical research is much lesser. So I think we need to improve upon this. How are we going to do this? It's hard. I mean, it's a very, very complex question. There are lots of barriers here. Sometimes it's cultural aspects. I mean, in past, medical systems did not serve African American population very well. And I've heard about the Tuskegee experiments and many other experiments in past that were done, and there is a bit of distrust possibly in certain populations. That's one problem. Number two problem is there are not enough interest on national level in big organizations in promoting research in this group. I suspect that, I sense that all the time around me. I don't know how much of it is intentional, how much of it is just oversight. It's hard to say. But I think we really, as doctors, we need to encourage it. The African American population on their own needs to support this initiative. You need to ask your doctors, is there anything specifically that I can participate in it that can improve the outcome of cancer in our communities, for example. And then you need to ask your doctors, basically, if a person has cancer, they need to go to ask the doctors, is there anything newer that I can participate in? Yes, ma'am.